Pronounced are. Good afternoon. Blue weather now with are as well. Welcome to this meeting of the Social and Healthcare Overview and Scrutiny Committee. Before we begin, I'd just like to welcome Pam Wilkins to the meeting, the new Council's new service manager for older people and localities. And we'll begin with agenda item 1, which is apologies for absence.
Thank you, Chair. No apologies have been received.
Agenda item 2 is declarations of interest. Any members like to make any declarations? No indications. Agenda item 3 is the minutes, which is to confirm as a correct record the meeting. Minutes of the meeting held on the 4th of December. They're on pages 5 to 8. Moved by Councillor Mackie. Do you have a seconder? Councillor Claydon. All those in favour of the minutes? That's carried. Agenda item 4, urgent matters agreed by the chair. There aren't any, so we'll move on from that. Agenda item 5, forward work programme and action tracking.
Thank you, Chair. So if we go on to page 13 of the agenda pack, as you'll see, we've got quite a few items for February, and there will also be a budget item on that agenda. For March, again, we've got 5 agenda items, and then there will be a break in the for the election there, and then we'll start reconvene on the 4th of June. So again, busy meetings there. Does anybody have anything they'd like to put forward for consideration? Clearly, we have got a busy agenda, but we Councillor Claydon's indicating, Chair.
Thank you. I think one of the main issues that has come out recently is the £6+ million overspend, which is obviously a concerning matter, and it will have implications for the future and for our budget setting. So I think that it would be very valuable to the entire committee if this was looking at future overspend was an item that comes up regularly, so that the committee can keep an eye on it and analyse what's going on. Thank you.
Thank you. That is something that corporate resources keep an eye on. They have a monthly budget monitoring report, and they are expected to send through to us if they do have concerns. Then they raise it with this committee, and we would put it on our agenda. That's normally how it works. Are the members of corporate resources on this committee? Yeah.
Yeah, can I just come back on that, because I think it has, looking at the budget also has practical applications, which this group does look at in terms of how we spend our money and the services we offer. So I do think that it should be on this agenda as well.
Chief Officer, how have you?
Obviously, we wouldn't want to duplicate CROSC, quite clear around that. However, the reality is we do have significant budgetary pressures this year, and I'm concerned in terms that those commitments will be still there in terms of demand going forward, and having some added value about understanding where we are budgetary and what we're doing. So, for example, some of the items that I see on the forward work programme are about how we manage demand, how we target our resources, how we do things differently, how we do things in a transformational way. And underlying to all of that is the reality that we need to ensure that we deliver within our resources, both human and financial, and meet the needs. So I think there is an interrelationship. So I think a focus on not replicating CROSC, but understanding where we are and what we're doing in response to that, and maybe committee holding us into account, and not just being purely fixated on the number, but actually the activity and what we're doing and how strategically that's informing where we go which I would see scrutiny having a valid role about scrutinising our response and the impact that has because of the financial pressures. It's a very long answer, isn't it?
Councillor Buckley online.
Yeah, and just to say on that as well, we do now have I'm not sure I can recall the full name of it, the Committee Work Coordinating Group, which the Deputy Leader set up to replace the Climate Change Committee. And part of that group's remit is to look at items which might overlap between committees, where there might be a case to have joint meetings of committees as well. And I understand that's due to have its first formal meeting early this year. So as the chair of the committee, I can take this item to that group as well, as an example of potentially an area where there is a bit of overlap between two committees, and that can be something that Committee Work Coordinating Group could look into, if that would satisfy you as an initial step, Councillor Claydon.
Yes, I think that's a good way forward, but also it needs to be discussed here, I think.
I've got Councillor Buckley online.
Thanks, Chair. Can I add something to the Forward Work programme, please? Can we get the Sports Wales 60 Plus Active Leisure Scheme added onto the Forward Work programme? And I note we did speak about this as agenda item in June 2024, I think, but I think we've had a change of leisure operator since then. So I think it'd just be helpful for members to receive a report on local take-up, any outcomes and any barriers to accessing the scheme, and an updated detailed list of all available activities and how easily residents can access that and find that list. Thank you.
Okay, well, just need to double check whether or not that can hear, or whether they already have that information. Kerry, does that already come to one of your committees? Sorry, it's information on Active Wales. Is that it's no, okay. Yeah, that's something that we can look at. Thank you.
I did notice Councillor Joe and Councillor Healy also indicate, so I'll bring you in.
Diolch, Chair. Pnawn da, pawb, and a blwyddyn newydd dda. Very happy New Year to you all. I was listening to obviously what Craig said on response to Councillor Claydon and what you've said yourself, Chair. That's fine. I think that's a good way forward. So we do keep our eye on it through CROSC, that's what CROSC is there for, to hold us to account. But also that scrutiny members can have a look at the budget as well. And, if there's any issues, to discuss them, within these four walls. So I think it's a really good suggestion, but if you take it forward to see if we are allowed, able to do that first, through that new committee. And because, we need, it's such an important issue, obviously coming forward now. And, but to be scrutinised by this committee, I can't see any problem with that at all, as well as CROSC. Diolch.
Councillor Healy.
Diolch yn fawr, Chair. Thank you very much. I just want to say I totally agree with it, but it would help the budget as well. And councillors, how can I explain it? Councillors will know why, because we always have to look, why has there been such a big overspend? So when it's in front of us and it's written, that is what we have overspent for, and that's what we are doing, and that's where we are going, that's much better, because it will help scrutiny here in CROSS and in the budget, with the budget. So I think we should have that, definitely. Thank you.
Thank you, Councillor Healy. And just to say, from my point of view, I agree with both yourself and Councillor Claydon. I'm just conscious that the committee work coordinating group was put forward by the deputy leader, and one of the reasons he did so was because he thought there was duplication going on at committees, and he didn't want that to continue. So I don't want to, create a situation which might undermine the work of the committee work coordinating group, which is in its infancy. So I think it's probably safest that we take it through that process, given it's a new process as well. If it doesn't work, then, you know, we can always use the process we've always used.
But not all councillors are on that committee.
No, true, and I didn't agree with its creation, so we're opening a bit of a can of worms there, but I think that's probably a shrewd way forward to begin with. Do I have any other members who'd like to put forward anything for the forward work programme?
Carry on with- Okay, so moving on to the action tracking. Clearly, there hasn't been, we've had Christmas in between, so there are still quite a few actions open here. As you'll see, there are the rota visits, I think they are definitely moving forward now. So if you haven't already been contacted, you will be very soon by Gareth Jones, who's moving those forward. So most of them are open. The one for Councillor Coggins-Cogan, I think you've had that information, is that correct? Around Tunis. Yeah, so that's actually completed now. The extra care visit, that's again work in progress. So I think those are all the actions. If everybody's happy with those, Chair, then we can move to the recommendation. Thank you.
Okay, we've got the familiar recommendations. There's the three that the committee considers the forward work programme and approve and amend as necessary. That the facilitator, in consultation with the chair, be authorised to vary the forward work programme, and that the committee notes the progress made in completing the outstanding action. So do I have a mover for those three? Councillor Coggins-Cogan, seconded by Councillor Lister. All those in favour? Looks like everybody. Thank you all. At this point in the agenda, if it's okay with the committee members, what we're going to do is flip the agenda, reverse it effectively, start with agenda item 9, go through 8, 7 and 6, just because officer availability means that's going to be a lot easier for them to be able to present the reports. So if everybody's okay with that, we'll move to agenda item 9, which is collaborative conversations, Flintshire County Council's practice model for social care, and that's on pages 51 to 60. And I'll pass over to Sarah, Grant and Kate for this.
Good afternoon, Prynhawn. My name's Kate Brooks. I'm here to discuss the report on the collaborative communication model. Having a clear practice model is vital to provide consistency of best practice for children and families and to support staff. Collaborative communication is a relationship and strength-based model which embodies co-production and reflection, whilst also focusing on outcomes and is in line with the Social Services and Wellbeing Act. The aim of this approach is to build relationships and trust with children and families through skilled conversations. This model supports the effective child protection model, which has been developed to strengthen child protection work across North Wales. To date, over 190 members of staff have received training in this model, and 5 Flintshire employees have been trained as internal trainers to deliver the course in-house. 19 mentors have also been trained. The role of the mentor is predominantly to deliver monthly reflective groups for staff to sustain learning and embed practice. They are also a daily support for staff championing the model. An initial approach was taken to implementing the model within existing workforce resources. Despite early momentum, progress slowed and highlighted the need for a designated lead to coordinate and drive the work. Key challenges included reflective groups not being established due to a lack of coordination. Some teams are not yet using the model consistently in daily practice. New staff, both permanent and agency, have not received the training. And mentor engagement and enthusiasm has decreased due to inactivity. Staff feedback highlighted the need for clearer direction and support from management to embed collaborative communication as a core expectation, particularly given the pressures of social work in the current climate. Now that a lead officer is in place, myself, an implementation plan has been developed to re-establish and embed the model. And key actions include a training programme, the re-establishment of mentor-led reflective groups, ongoing support for staff through the introduction of a monthly drop-in session and the opportunity for individual strength-based case discussions outside of this. And communication and resources will also be offered via staff briefings, development of a dedicated page on the InfoNet, and the inclusion of collaborative communication and strength-based practice within the local authority's e-books. It is acknowledged that change and implementing a new model of practice takes time, and the implementation plan is aimed to provide a realistic and achievable timeline to re-establish the model. The current recommendations are: 1, to support collaborative communication training as a core requirement for all staff in children's services, and 2, to recognise the vital role of senior and middle management in championing and modelling this approach, actively reinforcing a culture of collaboration and consistency across all teams to embed sustainable outcome-focused practice.
Okay, I'm just going to come in there. So this is Kate's first time at Scrutiny, so didn't she do well?
Red-faced.
So I think just picking up on the important points that Kate has made there, very much in Flintshire in children's services now, we are driving very clearly our new practice model. To start with that, we have to get the collaborative communication aspect of that right. Now we've got Kate in post, which is a grant-funded post, so we have the funds wrapped around that. We're able to do that now. Kate is able to drive this at the pace she's driving it, to do it really well, to do it robustly, leave no stone unturned, as they say, because what I've been very clear about, to get this right, we've got to do it at the right pace. And the first thing that we need to do is bring the collaborative communications into everything that we're doing. And that's about us as professionals working together. It's about the multi-agency aspect of that. And it's also about how we work with our families and our children. So Kate has got a very good implementation plan that it changes, it moves, it evolves. We are reviewing that monthly. We're looking at how we can perhaps move other things slightly in line with perhaps the needs of the service. For example, Kate is going into a particular team shortly to help with them. So it's very much being embedded. And I'm really glad we've got Kate in post now, because this is a very, very important piece of work. So thank you.
Thank you.
Any questions for us?
Councillor Coggins-Cogan.
Thank you, Chair. Well, as it's your first time, Kate, I have a couple of serious criticisms of this report that I expect you to answer on your own. But no. My reputation isn't quite that bad. No, don't let on. She's only just joined. It's fine. No, congratulations. I think you presented the report really well, and I know it's not easy coming in front of us. And doing that, so well done. I don't come from this sort of background, so you're talking to someone who's best described as sort of like an idiot, really. So you have to sort of dumb everything down for me. This, I mean, it reads, it's very interesting to read. I wondered, would you be able to give me an example of what this sort of communication is? Just because you describe what it's doing and how good it is, but I don't know what it is. So would you be able to give me an example of, the bad previous communication and then this new communication? That would be useful for me. But other than that, I'm happy to move the report, blah, blah, blah. Thank you, Chair. Thank you.
Yeah, I think an example would be previously social workers might have focused on perhaps asking questions that might lead you down a certain path, rather than going in to discover, and really letting the family, building that relationship with the family so that they're comfortable to share information, but also being really open-minded, rather than asking a designated set of questions that our assessments and paperwork might lead us down to. It's about really going in, learning to discover, because sometimes some of the presenting behaviours there might be something underneath that. It's about really getting to the bottom, what is at the heart of what's going on, and making sure we're not being perhaps distracted by some of the behaviours, and really getting to the heart of it, so that we can then work with that family to address those issues, and that hopefully will stop them from coming back into the local authority through that revolving door. I don't know if that's actually makes sense.
It does. I'll come in there as well. This is very much built on a strengths-based model. So, so rather than having a prescription, so you, so for example, if you come out of a child protection case conference and you've got a prescription of kind of 10, 15 things that a family must do, okay, to improve the situation, this is about actually what are they doing really well, and if we need them to make these changes, is there another way we can get there that actually works for them rather than for us being so prescriptive? So it's much more a collaborative way of working. So yeah, I hope that gives you some idea.
No, thank you. That's really interesting. So I can see the chief officers about to sort of come in as well. No, that's really valuable. So it seems to be more, as I put into layman's terms, it's more about treating the individuals as human beings to have a dialogue with, rather than sort of going through perhaps what you could disparagingly call a checkbox of having to get through this, A to B to C. Chair, I'd like to slightly take back what I've said with the recommendations. I'm happy to move them both, but with the second one, I'd like to change it to the vital role of management and take out senior and middle. So I'm not sure how helpful that always is. So yeah, especially with such a small team as well, I'm sure Craig makes the tea in the office sometimes. Thank you, Chair.
Just picking up on language, it doesn't mean that the old approach was bad. It was a different approach. So I just have to highlight that. But I think that did and could focus on all the risks and all the negatives and look and say, these are all the wrong things that are going wrong in Craig's life, and he needs to go on a parenting course. I've prescribed that. It's very much moving, as Sarah says, to what are the strengths, what's important, what matters, and what change is needed, and how Craig could be engaged and take control of that change. I think this is really important because I always go back. We had the CIW inspection and a report in February 24 and again last year. And that highlighted two things for me. One was around the need for a consistent practice model, which this is, because we are, and the reality is, we're still reliant on agency staff. And that was leading in when we presented the CIW action plan, you may recall that was leading to some inconsistency in practice. So individuals coming from agencies. So this gives us a very clear flincher way of doing our business and our practice. And whilst we have people that might come and go, at least for our residents, there's a consistent model about how we interact and our focus. So that's really important from our residents' perspective, and also to demonstrate to CIW we've listened and we're doing something different around that. But also for me, this is really important in our strategy about retaining and attracting our workforce, because all the evidence shows that when people feel safe in their practice, feel supported in their practice. So Kate's talked about having mentors, about that real intensive support. People actually feel more confident and want to stay for that organisation because they feel safe in a high-risk job. So it's better for the residents, but I would contend it's also better for our workforce. And over time, as people see that there is that supportive framework for our staff, hopefully more people will want to come and work with us and they'll stay with us. So I think for me, strategically, it's really important as well as operationally.
Councillor Mackie.
Thank you, Chair. Yes, well, thank you for everything you've said. I read the report and I decided I wouldn't make any notes. I'd listen to what you had to say first, and I've done that very attentively. For what little bit I know about children's services, I can understand how lists and checklists and following pre-described issues is important, because in the case of children's services, a lot of the work is about making sure that you cover all the ground and so on and so on. And it does say right at the beginning of the report that it's the checklist style and move that you would be hoping to move away from scripted and the checklist style. So that sort of gave me a little thought that was, well, hang on, will we be covering everything? And then it's been said that our reliance on agency staff is important. And again, I'm thinking, but then it's important that they don't miss anything. So I'm leaning that way all the time, if you see what I mean. And then I looked at the fact that you've already completed training for about quite 190 of the staff and so on, but clearly it's not got in there somehow. And to me, this is having got to a point where 190 staff have been trained. You've taken feedback and decided that we need to have a second go at this, a rethink about the way it's been implemented. And I'm getting nods, so I presume I've got that bit right. So yes, I think what I'll do is I'll take my original advice. And I think what I'll say is I'll let this go for the moment and I'll see what comes next with the next report, which is either going to say, hey, it worked wonderfully and we're now on the track and we're now going down that road, or it's going to say, we're having another think about this. So I'm going to leave it at that. That's where I am. I've not got any questions other than that. Is that all right with you?
Absolutely. I think what I'm going to say there, Councillor Mackie, is very much, yeah, I completely accept there that you can see that almost like that stop-start, isn't it, of what we've done. But there are really good reasons for that, in that we didn't have the staff, we didn't have the person to be able to naturally go from all of that training to then moving it forward. We had a big gap. So what part of Kate's role now, to hopefully to reassure you, is actually she's reliving that, she's going back to the beginning, if you like, which she has been and is now moving forward. So I think there's more staff being trained, isn't there? There's a plan for more staff to be trained.
We have. There's 5 members of staff, including myself, that have been trained to deliver the training in-house. We're just finishing up the materials and there will be training coming out for new starters. I'm going to be providing refresher training for those that have done the training but perhaps haven't used it. And I think what I realised when I first came into post that whilst people have been trained, the training can only take you so far. You need the framework around it for people to, you know, the reflective groups are that monthly reminder to work in this way and that support to work in this way. And that was missing. And that I think that's why the momentum was lost. So it's now for me about building that framework and building this into everything that we're doing and hopefully making sure our other trainee is complementing this way of working.
What we don't explain in the report, and sometimes you forget that people don't know what they don't know, is that across the UK there are a number of practice models. Some of those are licensed and you pay for. We've not gone down that road. The model that we have adopted is one that was developed by Social Care Wales. So it's very specific for Wales. It's been implemented, it's been evaluated. We've got an evidence base that this works and this does support practice. So it's not that we're trying something out and seeing how it goes. We have a tested framework, we are following that methodology. So that's why I have confidence in it around this is the right way to go, because we've seen, and I've spoken to colleagues across Wales who've been able to demonstrate the impact that it's had. So I just wanted to assure you that we just haven't blindly gone, oh, we'll have that one and give it a go. And we probably don't say that strongly enough in the report, but wanted to give you that assurance.
Councillor Thew.
Diolch, Cadeirydd. Yeah, I just would like to know is, as this is a new role, and in view of budget constraints, is it to be a secondment for a period of time to sort of embed it and see how it goes? I'm very impressed with Kate. You've done a fantastic job today, by the way, and I realise this is a really ambitious scheme, and you know, I wish you all the best. But I would like, that's the question I would like to ask. And oh, and also, are you a homegrown Flintshire employee previously? Thank you.
So I don't think it's fair in terms of the process to expect Kate to answer that. So I'll give you my perspective on it. So this is grant funding. We've managed to secure grant funding. All the 6 North Wales authorities have got grant funding. There's 5 of us who are implementing the effective child practice element of this. That funding is available this year and next year. There will be, that grant then comes to an end, but there'll be a second iteration of that grant. I'm really clear for the next couple of years, we are using grant funding for this. We will then look to use grant funding for it to continue. The worst case scenario, and is that if that grant funding ceased, if there's absolutely no affordability within the budget to do this, I think what's really important is the model we've taken is train the trainers. So it's our own in-house. So we're not reliant on paying people all the time. They're all in-house mentors. So we've got the infrastructure. We might not have the person who's driven it in terms of that funding, but we've got the infrastructure. When we appointed Kate, we've got a very, very experienced practitioner. She has come from another authority. We managed to attract her. I won't say poach. We'll say we managed to attract her to come and work with Flintshire because she was really passionate about what we're doing and wanting to deliver that. We've got lots of vacancies and we struggle to recruit really experienced managers. There are lots of positions, you know, we see Kate as, you know, it's a permanent appointment. It's a permanent skill set we've employed at this point in time. We've got grant funding to deploy that skill set. There are plenty of skills that we can continue. And I don't want to get into individuals, but I think the question's absolutely right, is that this we see as core task, and we've been fortunate to get grant funding and fortunate for someone very skilled to take it forward for us.
Councillor Lister.
Yeah, thank you for the report. The collaborative communication model is obviously a new approach to working, isn't it? And there's lots and lots of different people outside of the authority that work with those children at risk. And I just wondered whether there was any plans to share that new approach with education staff and potentially healthcare staff, and even colleagues in the education department that work with our vulnerable children. Thank you.
Yes, that is part of my implementation plan. With the effective child protection and collaborative communication, it's hoped that later on this year it will be incorporated into training that we already deliver to our partner agencies. So we currently deliver conference and core group training to them, but I'm hoping to include collaborative communication, the effective child protection model, and just develop it in terms of our thresholds as well, just to help build up those relationships and to increase understanding. There will also be a series of briefings to them, written and hopefully online, before we progress with that training. So it's definitely on the agenda.
We've also given a commitment. We need to get this working in social services. We need to be embedded. We need to work with our partners, as you quite rightly identify. What we have given a commitment to do is, when the time is right, when we've implemented, we've impact assess about what difference has that made. We've already started to have inquiries from youth services, education, when we've talked to colleagues there about this practice model. What we've said is, let's get everything aligned, but certainly they're very, very interested. So we do need, and our thinking is thinking about actually how does the whole system around those children and families speak the same language, take the same approach, so they're not kind of having different professionals coming in and out of their lives using different terminology and different approaches. So ultimately, that is exactly where we would like to get.
And just on that point, really, and I think that's why it's actually so important that we do roll out that training, that multi-agency aspect, because we do find at times perhaps a child may remain on the register for an extra period of time around, because that's kind of, there's some worries from one of our partners rather than because there's actual reasons why. Do you understand what I'm saying? It's about, yeah, so it's actually about if we're all working from the same model, the same strengths-based model, a child protection plan isn't always going, you know, it's not there, is it, to, it's a tick box in some ways in terms of keeping that child safe. What's important is what's wrapped around that family. So I think to change the language and to have our partners on board and the training around that and the thresholds, it will help in those forums so we can have those collaborative conversations and really kind of drill into what's our reason for wanting to stay on the register here, or another scenario.
So we've had the 2 recommendations moved by Councillor Hawkins-Cogan with the removal of the word senior in middle in the second recommendation. So do I have a seconder for those? Councillor Lister. All those in favour? That looks like everybody. Thank you all. Thank you, Sarah, and thank you, Kate. I hope your first experience of Flintshire Scrutiny wasn't too bad. So we'll move on to agenda item 8, which is technology within social services, and I'll hand over to Jane Davis for this.
Diolch yn fawr iawn, Cadeirydd. Pnawn da pawb. Braf iawn gweld chi a blwyddyn newydd dda i chi gyd. Thank you, Chair. Lovely to see you all and Happy New Year to you all. Thank you very much for the opportunity to talk through some of the technological and digital solutions that we're working on within social services in Flintshire, and to give members oversight into some of that work that is currently underway. So, as you know, it's really important within social services to have a person-centred approach to care and support. And I think whenever we bring reports and you ask us questions, people are always at the centre of everything that we do. However, as part of that, it's making sure that we're using our resources as efficiently as possible. And so digital can help. It can do some of the background work that maybe officers may be involved in, which takes them away from that frontline care and support. And it also means that we can be as effective as possible because we can connect to different systems, draw data from different places, and help us to get that holistic view of care and support for individuals. And so this report sort of brings together some of the activity that's going on in that field at the moment. I would say to members at the very start, this is not about robots doing care for people, and I just want to make that very clear from the start that this is very much about how we harness that power of support to be able to improve the outcomes for people. So you'll see that I've made reference in the report to the digital in social care DISC framework. Across Wales, the framework was launched back in November time. And this is very much a Welsh view of how digital can support particularly social care. And it's a really good way of us looking at what we're delivering, how that's making a difference, how it's connecting with other partners and other agencies so that we face some of these challenges together, but that we take advantage of the fact that we can work in partnership as well. So the DISC framework is built around 4 key principles or pillars: big change, bright ideas, brilliant basics, and building knowledge. And for us in Flintshire, we've got activity in all of those 4 key pillars. So if I start with big change, It says what it does on the tin for this one, which is always very helpful, isn't it? So, so big changes very much around ensuring that we are driving fundamental changes to the things that we do so that we're ready for the future. And so that readiness for the future is today, but it is also in 5 and 10 years' time. And it's very much an aspiration of this programme that we work integratedly with other key providers. So for us in Flintshire, the major piece of work under this particular pillar is the implementation of the new Mosaic platform. I know you've heard me talk about Mosaic before. And you've all heard me talk about Paris previously, and you all know it's not the city, but the case management system that we operate on that holds the data about the individuals who receive services from us here in Flintshire. So Mosaic is the successor system to Paris. Mosaic is being implemented across Wales. So there are, I think, 17 local authorities in Wales who are part of the implementation process at the moment. All of the 6 local authorities in North Wales are moving on to Mosaic. It's a real change. It's a different way of delivering that information system for our clients. And what it's done as well is ensured that Welsh Government has been part of those conversations. So Welsh Government has set up a Connecting Care programme coordinated by WLGA to help us as partners to be able to deliver that next generation. It's also about making sure that the data that we hold is standardised, focusing on having a standard approach to data collection, which supports then having data about Jane Davis when I'm in the miler, being data about the same Jane Davis when I'm receiving home care at home. So data not being shared necessarily in all its detail, but being able to connect that data together, which is really important, so that helps to expedite hospital discharges, but it also means that a holistic view of Jane Davis is available to practitioners who are working with her at that particular time in her life. And also this piece of work is national, and that's really important as well, because it means that it supports the fact that Jane Davis may not always live in Flintshire, may move to Denbighshire, may move to Rhondda and Tav. My husband doesn't know this, we're not going, but you never know, do you, how it'll pan out. And of course that then also helps to support that transition if I move around. For Flintshire, Mosaic we anticipate will go live in November of this year, which gave us all a bit of a fright when we crossed over into the new year and went, this year, you say? This year? But a huge amount of work is ongoing at the moment within the teams to ensure that the system is fit for purpose from our perspective, and also create some of those future possibilities. So we're not limiting ourselves to what Paris can do now. We're looking at the future of what we want it to do in the future, and that's a really important part of the conversation. Bright Ideas is the next bit. So this is about evidence-led, innovative solutions, looking at research, looking at technology, looking at different ways and innovative approaches to be able to deal with some of those emerging issues, some of those wicked issues that we often talk about. And this is very much about embracing new ideas and new technologies, but also being aware of research that's available to help and support us to embed some of that. In Flintshire, we did undertake an early pilot of the Microsoft Copilot AI model, and we did that within social services. Really interesting pilot for us, limited in its scope because of the nature of what we wanted to achieve, but very much supportive of the communications and the administration that goes on. Something that we did identify is we need to know more. So we are in the process at the moment of engaging with our corporate IT colleagues about what AI can offer for us for those back office functions to help and support our social workers, our social care practitioners out in the field, our children's services assistants and all the support workers out there to streamline their work so that they can crack on with the really important task of having those face-to-face conversations with people. And so we're working corporately at the moment to look at what other products are out there and to enter into a procurement process of what those may look like. And I think what the co-pilot pilot has shown us is there won't be one size fits all. There won't be one solution. There will be lots of different solutions that meet different aspects of the work that we do. And that's the same across the council, I'm sure. So another area that we've looked at as well is maximising what we already have. So we have invested in software systems over the years. Controc is a good example of a recent investment, market leading, and is support for our financial assessment and charging team. So Controc is all about helping us to make financial assessments for individuals so people know how much the care that they're receiving is going to cost them financially, or if anything, and also to be able to bill for those care fees, but also to be able to pay our care providers when we commission them to deliver care on behalf of the authority. So really critical. Also covers children's services as well as adult services and foster carers, etc. So it's a really key fundamental system for us, second in line, I would say, to Paris. And so what we've done is looked at what else can it do for us, because it's doing the core functions, what else can it do? And some of the other things that we've introduced is the provider portal, which means that our care providers have access to the back end of the system. So instead of sending in their invoices in a paper format or in the post or via an email or whatever, they can upload their invoices through the portal. That means that they're getting checked at the same time, so that saves time, saves effort, and any queries are addressed there and then, so that providers are paid in a timely way, and also we have up-to-date and valuable information in a timely way as well. So very much a self-serve approach for the providers. And another thing that we're looking at there as well is to look at how the financial assessments system can become more of a self-serve system. As you know, often the referrals that come into social services come via the hospital routes, and that can often be following a crisis. So, you know, mum has fallen, maybe broken a hip, maybe other things have happened, and suddenly care and support is required in a very different way for mum. And it may be a care home, it may be home care or whatever. And that's a really challenging time for families. And there's a lot going on and there's a lot of change and it's all happening at once. And one of the key questions that families will ask, as well as all of the things about, you know, where will mum be going for care and what's it like and how will that be arranged and who's the social worker, is how much will it cost us? Because that's a key consideration as well as part of this. And so the Controc system can assist us in that, so families can input information in about their financial circumstances securely into the system. And what that means is it gives them indicative costings early on so that they've got something to work on, if you like. And then that also helps because that information is then captured straight into the system. So any additional work that needs to be done is done from within the system, and that then expedites the financial assessment from the authority side of the fence as well. Another key pillar is around brilliant basics. So this is all about understanding some of the key challenges that we have for people who are delivering care and support, and those who are receiving it as well. And it's about making sure that, you know, our foundations are good. The basic work that we do is strong from a digital point of view. And so an example of this is the recent implementation of a system called One Touch, which is a staff rostering system for domiciliary care or home care. So previously we had a rostering system which was very labour intensive, meant that managers had to go through a process of identifying which care rounds, who was doing them, who's on holiday, who's off sick, who's gone back into hospital, whose daughter is over from New Zealand, doesn't need any care this week. You can imagine, can't you, how rostering looks. And so One Touch helps and supports us with that. So, and it's a dedicated social care system as well, because there are regulatory requirements that we need to report on for home care, and One Touch helps to support that as well. So it speeds up the process, but also it gives us a digital platform to work from, which means that we don't have to print rosters off anymore. We can make sure that staff get that information on their device. Might be their own device, might be a council device, depending on their choice. And that information is at the touch of a button. And of course, they're trained to deliver that. And so that helps also with things like timesheets and others. So it's about getting the basics right, you know, getting the nuts and bolts right of the work that we do. And then our final pillar is about knowledge and building that knowledge, and also identifying and making sure that, you know, we're validating some of these digital solutions and ensuring that we know what good looks like and what we want it to look like for Flintshire. And so we've done a lot of work around investigating what is out in the market, but also making sure that we're tapping into some of that key information. Social Care Wales have already produced the Digital Potential Toolkit, which is a really useful piece of work, accessing information across the local authorities in Wales and our health colleagues as well, to help us as we move into this more digitalised age. And so why would we not use that information? We've also tapped into Cardiff University. They have the Scale Centre down in Cardiff, which is all about asking the challenging questions of technology such as artificial intelligence, and not accepting information blankly, but taking a challenging view of that. Talking about, you know, where the test data comes from, how models are built, so that we have the right questions to ask when we then engage in procurement exercises with providers. And that really helps us, because it means that, you know, some of the pitfalls that we've seen in early AI, we're wise to and mindful of, because this is new technology for lots of us who are purchasing, and it's really important that we also have that skill set early on, so that we understand what the world looks like and how it's being designed through some of these models and processes. And then again, the Connecting Care programme is a perfect example as well, where we're again using that programme and engaging with some innovative companies within the public sector to help us to think about our processes as well as the technology to support those processes. What does our front door look like in the future across adults and across children's and other areas? And how do we best support that efficient flow so that people who want to access our services are able to do that in a way which is meaningful for them, is efficient and is effective. There's lots more in there that I could talk about, as I'm sure you've already gathered, because I've been rambling on for hours already. What I will say under resources is, you know, a lot of this, there's a lot of talk, isn't there, about technology stepping into the place of humans, and, you know, especially in our very person-centred world, what does that mean? And so for us, very much this is about making sure that what can be efficient in the back, behind the person, is efficient. So that helps us then to manage the current demands that we have. We know the baby boomers are coming through the system thick and fast at the moment. And so I listened to Radio 4, and there was a reference to the python eating the pig, and the baby boomers are the pig travelling through the python at the moment. You can almost see that happening. And that is something that is very current for us as a local authority, but is for all of the local authorities in the UK. And so we need to know that demand is there, but we then need to think about, well, actually, what do we do to address that with the resources that we currently have? So this isn't about reducing staffing numbers or whatever. This is very much about making sure that we are making sure we can manage the demands that we know are here and that are coming our way, and also making sure that we engage in some of that preventative work that we know also helps us to manage that demand and is much better for the individual and their families if we can deliver preventative work up front. Sorry, Chair, happy to take questions.
Thank you, Jane. I've got Councillor Mackey first.
Right, thank you very much, Jane. Start off by saying I've been here before, because I was actually sitting on this committee when Paris was introduced. There we are. That's a few years ago now. It was traumatic. It was amazingly traumatic. We had a senior officer who was responsible for it and a team. And I recognise that. And we talked about, and I can't remember the name of the system it replaced. It was something care, isn't it? That's right, care.com. I was nearly there, I was getting there. And it was talked about in derogatory terms when we talked about Paris, which was going to be this wonderful system. And I'm sure it took at least 2 years to actually just do the implementation. Right, I don't know why I've said that, but just to show that I've been around a long time, I guess. Yeah. So here we go. Now Paris is the old system and Mosaic's the new system. And Mosaic is taking over, and it's going to become the all singing, all dancing system we have. The first question I've got is clearly it will integrate with Wales, because although I'd rather have 22 counties working with the same system than only 17, and to me, if it's so few that aren't doing, I think a bit of pushing in the right direction should have been implemented by the powers that be, because quite honestly, that is open to problems. So anyway, that's not for me. But my question is, what about links with England? That giant over the border where some of us do actually get our health care when we can. So that's my first question. Now, you then went on to talk about numerous other IT solutions that are also being implemented at the same time. And my first question is, can't Mosaic help with this? Now, you're probably going to tell me exactly why it can't and everything else. Okay, fine. But if we're going to have an integrated system, we really should have a fully integrated system. And it's all very well and good saying this gives us the front end for this and the back end for that. And it means we can bring this in round this corner and this round the other. But we still need today a fully integrated system, because quite honestly, that's the way the world is going. I have a relative who was involved in looking after vehicle tires. Believe it or not, if you know a vehicle, the people who supply the tires, and it's done on a contract basis, will tell you exactly the code number for every tire on every axle of that vehicle at any given time. We don't do that about our people, and I think we should. I really do. And the only way to do it is to have a fully integrated system that really makes sure that everything links in. So we've got our own corporate IT solutions, you mentioned. I may not have written all these down. We've got billing and paying system that's being implemented. We've got costing and family costs, so families can determine what costs they're likely to have to bear. The one-touch system, and I haven't written what that was for, but you mentioned that. And then connected care program under AI. Number one, it's a lot of things to be doing at the same time, and I'm sure you're capable of it, but I must ask the question. And then number two, it's the integration really, and are we heading for a situation where we're going to have to tidy things up at some point, or are we actually creating a nicely coupled up system? I hope that makes sense.
Thank you, Councillor Mackie. Yeah, absolutely. 2010, Paris was implemented. For you to know, you were here. Yeah, absolutely. It was traumatic, is what I recall, and fortunately, Paris was an implementation programme at the time between Denbighshire and Conwy and Flintshire, if you recall. So it was a three-way piece of work. But I think the points that you've raised are really valid. Just for clarity, Controc, which is the financial side of things, that was already implemented. So that's happened already. So that system is in. It was brought online and January 2025. So the piece of work to procure that happened sort of 18 months prior to that. Then we went through the preparations and implemented it 12 months ago. And the support systems and modules attached to Controc. So when I talk about the provider portal, that is Controc, but it's a separate part of it. So as you were rightly saying, having one system doing lots of stuff is very important. Another part of that Controc system is the bit where families can input information. So that's another part of the same system within the same. So they're sort of add-on bits, if you like, to the same system. We had, when we originally implemented Controc, the parent company at the time of Controc itself did have a client information system, and we were exploring and looking at demonstrations of that as part of, you know, knowing that Paris was coming to end of life. But that company has not wanted to be part of the Welsh local authorities implementation of client, and that's a business decision, isn't it? You know, for reasons that I don't know what those reasons are, but they have not engaged in that tendering process for this system going forward. The Connecting Care programme is the overarching name for all the activity that's going on with Mosaic and all the activity that's going on to make sure that our data sets are linked together. If you might remember, and I don't know whether you remember the words WCCIS, the Wales Connecting Care Integrated System. Other local authorities, not Flintshire, engaged in having a one system for everything, WCCIS. Sadly, that system failed for lots of different reasons, and it wasn't possible. However, what we have learned, I suppose, in Wales over that period of time is that the best way to integrate is actually to have common data sets and then to get the systems, all the different systems, to use the common data set. A bit like a Babel fish for those people who've ever read Hitchhiker's Guide to the Galaxy. So it's the bit in the middle that talks to everything, if you like. And so if my NHS number or my date of birth or my full name or my address are those common data sets, then Jane Davis here is Jane Davis over there and is also Jane Davis over there. And whilst my record might be on a different system, I'm still Jane Davis and I'm still connected to all those other records. And so that is the principle that we operate on under the Connecting Care model. And I think that's a much better way of delivering services going forward. Leeds City Council a couple of years ago adopted that as a way of working, and that has been a model that other local authorities have adopted. And in answering your question about England, absolutely, you know, we're very close, aren't we? And we've got lots of connections over the border. Having that common data set with England helps us as well. So we don't have to have the same system as them. We need to know Jane Davis in the Countess is the same as Jane Davis sitting in the Mull Community Hospital. So it's that connection of data that's important. I think, is that all your questions?
Councillor Coggins-Cogan.
Thank you, Chair. Thank you to Jane for the information. At the very start, you mentioned about what this isn't, which is about, you know, robots coming in and helping out. And I was very pleased when you emphasised face-to-face conversations, because the nature of the AI that is being introduced is simply a tool to enable practitioners and other people to have better quality conversations with patients and individuals. It's not a replacement. That is what it's for. And if the AI doesn't help, it gets jettisoned, I would assume. The comment, the aspect that I was most interested in, because I sort of, the most exposure I've had is sort of in the primary care world, sort of via my husband. NHS secondary care and NHS primary care systems don't communicate with each other properly. So Mosaic, I understand, coordinates quite well with secondary care. Does it speak to primary care systems as well? And how much of a barrier or boon that is to you? Because I understand that obviously most of your work will be with secondary care. However, with Welsh Government's new focus towards care in the community, a lot more funding and functionalities going to primary care. So I just want to sort of highlight that we have that ready, because I sort of, you know, my slight fear is that we're getting ready for the world now, which is obviously very focused on secondary care. In 10, 15 years, we're going to find actually it's completely switched to primary care and we're sort of lagging behind. So there was that question. And then, oh yeah, the other one I had, I think you've sort of covered it, but it's only because it's mentioned in the report. So I thought it must be mentioned for a reason. On page 45 in section 108, when you're talking about the contract system, the last sort of sentence, half sentence, says providers can engage with our services outside the normal working day. What sort of advantage does that give? Because I can imagine if someone's emailing in an invoice, they can email in an invoice at any time. I just wondered, there must be sort of a particular reason why you've added that in. So I'm not clever enough to work it out, so I need you to explain it to me. Yeah, and that's everything. But overall, thank you for the information that's in here. It is really interesting. And again, thank you for the caveat you gave at the beginning that this is about enabling better quality face-to-face conversations. Thank you, Chair.
Thank you, Chair. Thank you, Councillor Collins-Cogan. Yeah, absolutely. Completely agree with your reflections at the start regarding what AI is for and how useful it will be. With regards to your question about primary care systems, you are right. The programme of activity at the moment, we mentioned at the start, isn't it? A lot of the vast majority of the work that we receive at the moment comes through secondary care. That is the route. It didn't always used to be like that, as we will, many of us remember. It used to be very much through a primary care route, but currently that is where we sit. That's part of the remit of the Connecting Care programme across Wales, is to be able to connect all of those care systems together so that we have that common denominator for, as you rightly say, you know, systems within GP practices are very different to systems within the Myler or wherever it may be, and we need to have that joined up facility. So that's part of the work that WLGA are doing, because it's not a Flintshire thing on its own as such. It applies to every local authority and every health board. And just picking up on that point that you raised regarding the working day, absolutely, providers are of course able to email into the team, and that is the primary method of communication at the moment. What the portal does is it checks some of the information as well. So when a provider is uploading to say, I've delivered these amount of hours of care for this person in this month, our system says we expect the provider to have delivered this amount of care for this person for this month, and the two should come together. And what the system does is it does that reconciliation. So the provider at 10 o'clock at night on a Sunday evening, poor things, is uploading their invoices, knows that there's a discrepancy and knows that they can do something about it. They don't have to wait for an officer to come back to them to say, oh, Mr. Jones, there's a discrepancy with that invoice. We can't pay it at the moment. We need to know what the discrepancy is, work our way through it. because we can see the two sides of the coin through the portal, that means that the provider can then take action quickly or can raise something quickly with us so that we can take action on their behalf. So it just speeds the whole thing up, really, and speeds payments up and that sort of thing. So.
Thank you, Jane, for that. That's answered my questions. Not to take two bites of the cherry, but just sort of I think I'm right in saying now that all GP practices in Wales use the EMIS system. So there's one system that was encouraged by Welsh Government. However, then Welsh Government hasn't mandated that all health boards use the same systems. So Betsy uses a different system, and in fact it uses sort of two systems because it's got the 3 divisions, and I think the West uses a different system. So in Wales, we have the irritation that whilst local authorities and GP practice are trying to use the same system, the health boards are not. So in primary care, you also have, say, district nurses. They use a different system and they can't access the information on GP services. So it's a major problem. The reason I raise it now is so that, you know, in whatever conversations you have with other people beyond the county council, you can say you're getting pressure from whinging county councillors to try and sort this out. Because it is a ridiculous mess and it does lead to worse outcomes for patients. I mean, the prime example is medications on discharge. Patients come to the surgery with their prescription from the hospital, which cannot be fulfilled by primary care because they don't know what the drug is for, they don't know who prescribed it. And that happens daily, and, you know, just in this, you know, in our localities. So it is a crying shame. So whatever pressure you're able to bring to bear, so you put pressure on Craig and then Craig creates pressure upstairs, that'd be great. And obviously the cabinet member as well. Thank you, Chair.
Absolutely
agree. Those issues being raised are fully recognised. I think just to explain the ambition from this connected care programme, like Jane said, is that what we are moving to and working, there's a health work stream of connected care as well. And the ambition is to end up with a shared care record. So it isn't about having integrated systems. What it is about is we have the platforms so that, and this is where I get a bit lost, so that information can go into data lakes. And then from those data lakes, you pull out that shared care record. So it says, I've matched up and I understand this is Craig. And in the data lake, this is all the information feeding from those systems. And then we have a shared record across the agency. So you don't punch into different systems, you punch into your own, but you're able to, with appropriate governance. So so we're on a stepping stone. The first stage is Mosaic. Mosaic will be the stepping stone to a shared cared record. And that then in North Wales, what we have is a digital, I've just had to get it up to remember the name of it, a digital data and technology board. And that is where health and social care come together to look at how we start aligning all of this work. I think it's a long slog, but at least there's that forum where we've got the key people around the table. And so that's my forum to deliver these messages, which I will do.
Councillor Coppell.
Thanks, Jane. Great report, and obviously it's a lot of work to go forwards. It's a mountain of work, it seems. It's been a very long journey. But the question is about all of these things. We've heard before about previous systems and their defects and so forth and so on. But it's going to be difficult to quantify the benefits specifically for this piece of work and any future pieces of work. So, and half the time is that because you can't quantify the benefits, because we didn't have the search machine that we wanted to find them with. So you can't, and it's too late. It's gone, the history. So is it possible going for like a strategic thing to figure out what the benefits are, and there are many, obviously, but also to try to capture them, record them. So there comes a time when you're going to spend money on this system, and no doubt it won't be cheap. And so therefore you can actually do sort of a balance and say, look, that's what we're going to get, sort of some sort of quantifiable benefit, and that's what it's going to cost. Because I think a lot of systems, any big system, doesn't have that, because we get anything, HS2, NHS systems in the past, spend billions on these things. Someone gives us, it doesn't work, put it in the bin, get another one. And because we didn't know how to quantify it, we didn't know how to prove it. And we didn't know that because no one thought about how to catch that data. So and it's not like a work forward program thing. It's going to be a big structure thing going forward. Start figuring out what proves it and how to catch it would be a thing. Thank you.
Sorry, thank you. Yeah, no, absolutely. Interestingly, we've been looking at impact assessments of changes that we're doing at the moment and changes that we've done, and did the impact that we thought was going to be the case actually transpire to be the case. So that links to that piece of work in some ways. I mentioned the co-pilot pilot. We did do an analysis of costs versus efficiencies. The co-pilot pilot was quite limited purposefully because obviously there are governance questions and other things that we needed to consider as part of that, but particularly with the procurement of an AI solution for social services initially, I think that's something that we could build into the procurement process, but the process of delivery as well. So thank you.
I think it links back with the conversation we had at the start of the scrutiny meeting, which reflected budget is going up, demand is going up, spend is going up. So actually, how do these transformations help ameliorate demand, help ameliorate spend, and what is the impact about this initiative? So I think it's directly relevant.
Councillor Healy.
Thank you, Chair. I just want to say thank you very much, Jane, for a fantastic report. I can sit and you explain it so well. First, I would like to say is I'm very happy to hear face-to-face is still going to be there. My question is, will this system help the discharge from hospital? That is a big question. I know it is very hard. The hospital beds are full. People are being treated in corridors because there is no beds at all. And at the moment, people are frightened of going to hospital because they don't want to be treated in a corridor. So will this system help? Thank you very much.
Thank you. It's like you're doing a seamless flow into the next agenda item, isn't it? Which is always very helpful. But yes, and it not on its own, I suppose, are the two answers to that question. So yes, very much, at the moment, there's a new piece of work looking at how we can, as local authorities, access database information within hospitals so that we can see what they can see, so that we are all we can see the activity to support the discharge from within the hospital all the way through to outside into the local authority. So a piece of work is going on around that. What Mosaic will help us with, which is the key system that we're talking about when we talk about hospital flow, is at the moment, Paris, as we've said already, is 6 for Flintshire and has limited capability to give us fancy dancy reporting. It tells us how many widgets and it tells us all the stuff we need to know to support our activity from a performance point of view. What it doesn't let us do is to be able to make that into something dynamic and live, but because Mosaic is a new system, it is one of the smart systems, it means that it gives us that live reporting options, and so that will then link very nicely in with this data that we get from InReach from within the hospital, so that we can see what's going on. More importantly, we can see what's going on with Jane Davis as she's transitioning through, but also we can see those trends wider so that we can start to better understand when things are starting to fall off kilter. So as you know, the whole system is like spinning plates, isn't it? And we're watching a lot of plates all of the time. And having systems that help us to just see when that plate is starting to change are really helpful. And that's what we will get when we move into these next generation systems. So, thank you.
Councillor Owen.
Thank you for the report. I hope I'm not a little bit off track because the Paris system, so our police and schools can access that? No. Oh, so the police, so it's just social services that will be able to access this?
Yes.
Yeah.
Paris is our current system.
Right. Oh, sorry.
Paris is the current system. Police can access it under controlled circumstances. So, if there were a case that they needed to investigate for whatever reason, we lock down the system and provide information just regarding the requirements that they have, and that is observed. And education, likewise, if there is a need, then we are able to. In the future, with Mosaic, Mosaic is the same company, the parent company of Mosaic is the same company that provides Synergy, which is the system that our education system service use. And so we're looking at an add-on, if you like, that helps the two to talk to each other, so that if we've got a question about a child maybe in their education setting, that will help and support us through their looked after arrangements or their child protection arrangements or whatever, then we will be able to look into Synergy as well. Obviously, we all have to have the right, tick in the box to say it's okay for Jane to look at that. But that is because they're the same company. That means that we can talk to each other. So that's really good.
Thank you. Thank you.
Okay, we'll move to the recommendations. There's 3 of them. Recommendation 1 is that the committee notes the progress made in embedding digital technology across social services. The second is that the committee supports continued investment of resources into digital platforms. And the third is that the committee endorses the development of a Flintshire digital in social care framework. So to have a mover, Councillor Coggins-Cogan, seconder, Councillor Healy. All those in favour? That's everybody. Thank you. Agenda item 7 is developing resilient partnerships for hospital flow. I'll pass over to Karen Chambers for this item.
Thank you, Chair. Okay, so I think the imperative to support people to experience a safe and a timely discharge from hospital is clear to us all, critically for the individual themselves and their family. And I know you'll be acutely aware from previous reports on this topic and for health and social care systems as well. There does remain a constant and a high level of focus on delayed discharges from hospital at a Welsh and a UK level, and you can rarely look at any press to not see a report on that national challenge. Within the context of Welsh Government policy and guidance, and in line with good practice, discharge planning actually starts at the point where somebody is admitted. That's when the view about what somebody is going to need on discharge should start from that point. And the expectation, therefore, is that whenever a patient is admitted into hospital at a very, very early stage, conversations start to happen about what we call the pathway of discharge will look like. So are they going to go home with the same care as they had before? Do we think they might need some more but stay at home? Do we think they might need to be in a 24/7 environment, and so on? And of course that can change at any point, but those conversations and that setting of expectation starts very, very early on. So adult social care continues to play a critical role in supporting timely hospital discharge, as well as avoiding admissions in the first place wherever that is possible. We primarily become involved at or close to the point where the patient is ready for discharge. That is the optimum time that we can become involved at the moment. Demand remains high, and as a service, we do focus on trying to strengthen our community-based supports and improving our discharge processes in order to avoid delays. But as I've said, hospital discharge delay remains a significant challenge, not only for social care reasons, but for multiple reasons that are to do with systems within the NHS itself, and also the fact that quite often an individual is going back and requiring family support, for example. So all of those factors take a role. We also have some people with very complex needs where there are very significant legal processes, for example, with courts that need to be progressed through. So it's always worth remembering that hospital discharge delays only partly can be resolved by a social services response, but nonetheless, we take that role very seriously. Welsh Government planning and policy and guidance sets the expectation that every patient who is deemed to be discharge ready is discharged within 48 hours of that point. So that remains our target. And the report that is presented today gives members an introduction to a Pathway of Care Transformation Grant, which I believe we have spoken to over a period of time within meetings. This was a grant that Flintshire received of 1.47 million, and that is a recurring grant. And it's been awarded to local authorities in recognition of the investment requirement to support meeting the challenge that we all face, as I've said, in relation to discharges. And the primary focus of the new investment from a Flintshire perspective was to tackle 4 key areas of delay. One was awaiting social care allocation, so social worker allocation. One was awaiting reablement care packages. One was awaiting assessments, and particularly those of joint assessments with other professionals, and as I say, awaiting completion of the primary social care assessment as well. In addition, we know that there are other key challenges that we face in Flintshire. One of those is very much around the capacity for placements. So if somebody needs either a short or a long-term placement within a care home environment, that continues to provide us with an area where we can experience delays. So funding from Welsh Government under that Pathway of Care Transformation Grant allowed us to focus on a number of these challenges. And the way that we've been using the funding that's been provided are to increase assessment capacity, to speed up some of our processes and our approaches, to provide some short-term care home beds so that when people are ready for discharge, they don't wait in hospital for the next stage of the discharge planning to be effective. They actually can stay within a care home environment, and we refer to that as a step-down provision. We've also been looking at how we can enhance our communication and MDT coordination, expand occupational therapy input into hospitals so that from a local authority perspective, we've got an even higher level of assurance that occupational therapists have been involved in discharge planning to make sure that we look for the best ways that we can to maximise independence for individuals, and also to try and look at how we can speed up the process of looking for packages by bringing additional brokerage capacity into our team. So we have been using the money that's come into local authority this year around recruitment of new team members, and to also increase some of our capacity within brokerage, within financial assessments, etc. All of those very key areas of work that support discharge planning and support individuals to make choices that are right for them. But some of the challenges that we've had is that the recruitment remains a challenge. It really does remain difficult, particularly for social workers. What we are experiencing are that the new roles for supporting hospital discharge are almost entirely being taken up by social workers that already work for Flintshire but within other teams. So that has a consequential effect on some of our community-based capacity. So as you would anticipate, we continue to seek recruitment into those vacant roles, but it nonetheless is a consequence of this focus on hospital discharge. We've also continue to experience that we may speed up the assessment work, we may speed up all the work that needs to happen to determine what somebody needs, but when the capacity in the community for the package of care or the placement is not available, we've sped up the process to that point, but we remain awaiting that provision. And again, as members will be very aware and have always been supportive, you recognise the impact on our team of having three acute hospital sites, one of which is in England. We've talked about different systems. We have a whole different system there. So those remain the areas of focus that we continue to work to progress within. The report also refers to the importance of admission avoidance. I think everybody would agree that the best way to avoid being delayed in hospital is to not have to go in the first place, if at all possible. And that is something that we are very strong advocates for, and we seek any opportunity that we can with our partners to try and increase the opportunity to keep people at home. So some of the practical ways that we've been contributing to that, I talked about step down, which is come out of hospital, you go into a care home environment for a short time for your onward discharge planning and support. We've also been looking to provide opportunities for step up. So that's where an individual is at home, perhaps experiencing an escalation in their need, or their carers may be themselves experiencing increased problems, and we'll provide a short-term placement. Of course, this is in the context of not an infinite availability of care home placement, so it is important to say that, but we try to use all of the placements that are available wherever we can, and that's outside of county as well. Emergency respite also falls under that context. We also, within our single point of access, have a social prescribing team. They are focused on working with individuals and families who approach our single point of access, GPs make referrals to the single point of access, district nurses, other professionals, and that's very much based on what's available in our community that might help individuals. It is more of an early intervention and a more of a preventative approach. It's not something that could support with an acute episode of ill health, but they're the sorts of things that people can access sometimes earlier on when they feel like they're not perhaps thriving or coping as well as they can with their home circumstances. And then finally, I've also referred in the report to complex case meetings. So this is where we seek to work as a team across boundaries or silos that can exist within a department to say, how do we support this individual whose needs might not quite fit into team A or to team B, so that actually collectively we work together to identify how best to support that individual. The report then, I think, finally refers to, and it's not specifically about the funding, but it was relevant in the context of supporting flow out of hospital. It refers to trusted assessor. Trusted assessor status is becoming increasingly part of the narrative about supporting people to come out of hospital. And essentially what this means is, in the context of social care, that social care providers and ourselves as well, from an assessment perspective, we develop a trusting relationship with the provider of healthcare. So in this case, for example, Betsy Cadwallader Health Board or the Countess of Chester, whereby we agree to directly accept their assessments in certain cases so that we don't add to the number of steps it takes to support somebody to come out of home. And we, as the name would suggest, trust that assessment to move through our processes. This is something that we have started to pilot, particularly in one of our care homes, for example, from an in-house perspective, whereby the care home manager doesn't need to go back into the hospital to make sure that I can come back to my care home. I'm still the same person with the same level of needs, and that hasn't significantly changed as a result of the hospital stay. And also, we are very early starting to accept some assessments from the Countess of Chester currently, so that people requiring a reablement package of care, for example, comes out of hospital on the assessment from the hospital team, and we quickly follow up in the community then to assess those longer term needs. So those are that gives, I hope that gives members a flavour of the range of work that we're currently involved in. We do know that not all discharges go exactly how we would like them to go. And so under the quality and risk management section of the report, we are also working with our partners around what happens when there is an adverse discharge. How do we learn from that? How do we ensure that we respond appropriately to reduce the risks? That the imperative for a timely discharge is always effectively countered by that being safe and appropriate for the individual. So that is that's the sort of final end, if you like, of ensuring that cycle is completed. So Chair, if I'm happy to take questions or obviously clarify any further points.
Thank you, Karen. I've got Councillor Mackie first.
Thank you, Chair. I want to start off by going to the other end of this. Basically, what we're trying to do is to keep a creaking system going. I don't mean what you're doing, I mean what's out there. The problem is finding places for people to go. We had a meeting of this committee some years ago, I can't remember exactly when, and we held it in the council chamber. And it was to present a report which had been written, which explained the difficulties that our care homes had, literally providing the services. And I can remember going to one care home and they said, if one of our beds is not occupied on one night, on that date, we don't make a profit. And to me, that said so much about the situation in the care homes. Their finances are so tight that if they're just one bed not occupied, they're not making any money. And as a business, that's what you're there for. And without that working, things don't work. And what we need to have is we need to have a capacity, a spare capacity. And the only way you'll get that is if the care homes are funded to the point where, I'm not saying they make a fortune, but at least it's a viable business. A business which, if you were to go to a bank and say, I want to borrow money against buying this business, the bank would not turn around to you and say, no, it's not viable. Well, the bank would actually say, yes, it's viable. And that's the difference. And that's what these people were telling me. So I want to say thank you very much for what you're doing. At the end, particularly, you were sort of a little bit, we are trying our best. We know you're trying your best. And we should praise you for that. It must be incredibly difficult because the hospital can turn around to you and say, okay, we've done all we can do. We've decided a certain whatever medication's required. Now you get them out. And that person may not be fit enough to go home to where they were. I can remember, I made a note and I can't see it. I think it was Susie said this to us. It may not be her though. She said, perhaps an elderly patient doesn't feel very well, so tries to make a doctor's appointment and doesn't make it. And the next day and the next day. And then eventually she gets the GP appointment. But by then she's 3 or 4 days worse than she was at the start. So she then gets put into hospital. She's not the same person she was when she first recognized she needed help. Perhaps it's a relative, I think was exactly what she said, who pushes for a doctor's appointment because she won't do it. And then that person, therefore, is less able to come out of the hospital early because she didn't go in at the right time. And that's not our fault. That's not her fault. That's the GP system. And the whole thing is all conspiring to build up this problem. It's not our problem, it's a wider problem. The fact that we don't have enough social workers, we hear that all the time on this committee. We're trying to train social workers within the department, but that shouldn't be our problem. That should be a government problem to encourage people any way they can to become social workers. That's really important. And sorry, I know I'm waffling, but I just feel it's important that we say this, because when I was on the Community Health Council, when it existed, we were constantly being told about the numbers of people who were not able to be moved out of hospital beds. But it's not as simple as just a number like that. It's a much more involved issue that requires work right the way across the board. And that's what I'm trying to get across. So I feel that what you're doing is immense and incredible, and I can understand how you can't find social workers to do the role. I really can. I did have a question, by the way. So at 105, you talk, I think it's 105, yeah, you talk about the discharge pathway starting within as short a period as possible. Now, my thing's died. It's always dying. It's the bane of my life. And at 110, I think, that's what my notes say, you're saying you're going to start earlier. If you can follow me. So at 105, you say you start early, and at 110, you say you're going to start earlier. So I'm asking, could you sort of square those two out with me? Thank you.
Thank you, Chair. Thank you, Councillor Mackie, for your supportive comments, first of all. So thank you very much. Right, okay, so 101.05, that's about identifying at the point of admission what social services aren't involved at that time, but the clinical team will say, Karen's here, actually, based on what we can see at the moment, we think when Karen leaves hospital, she's going to need some care, but we think she can have that at home, or we think she can have that she'll need to be in a care home. So that's 1.5. 1.10 is the other end of the patient journey. Okay, so the patient has been assigned pathways. Now, at the moment, for a number of reasons, including capacity, the local authority doesn't get involved in discharge planning until the person is practically ready to leave the hospital. They're practically clinically optimised. Now, there's some good reasons for that isn't about assessment, because it's not efficient or effective for us to be trying to work with a patient who's still acutely unwell, trying to work out what they need. And the family's got enough to deal with it, etc. But we do believe there's probably a sweet spot somewhere in between where we can start to do slightly earlier work with an individual. So, for example, if the clinicians know that I'm the patient and I'm on a certain course of treatment, and actually it's realistic, in the next 4 or 5 days, they're going to be declaring me discharge ready. We're saying with our additional assessment, we're going to be looking at those opportunities to move our work just slightly, those 2, 3, 4 days earlier, it could make a difference. So that's the difference between 105 and 110. Okay, thank you very much. Thank you.
Councillor Maddison.
Thank you, Chair. Thank you, Jane, for a really interesting and I think positive report as well, actually. I do have a couple of questions. In terms of, I'm sorry if I missed this, but when you talked about the transformation of care package and it says annually and recurring, is that for a certain number of years or will it be continuing? And secondly, this may not be a question you can answer, do you think speedier discharges from hospital will lead to reduced waiting times in accident and emergency departments? Thank you.
Thank you, Councillor Maddison. So to confirm, the 1.47 million is recurring forever, unless somebody makes a decision otherwise. So yeah, so we always consider recurring as permanent. So it's as permanent as any other funding that's available. In relation to your question around, will speedier discharge make A&E waits shorter? It's probably not a black and white answer, but I think it would be, because there's lots of reasons why people are in A&E for the period that they are. And it's often assigned very significantly to discharge delays. I think it would be disingenuous to suggest that it doesn't contribute, because it's a flow through the whole hospital. So if you haven't got beds available to move people from A&E into, then it will be contributing. So it's a contributing factor. I think we would argue as a local authority, it's perhaps not as high a contributing effect that sometimes the narrative is given, I think. But we are very focused that we don't want anybody waiting in A&E for long periods of time, either because they couldn't find the support anywhere else, or it's the right place for them to be and the flow isn't being achieved in hospital. And we don't want people in hospital when they don't need to be there. So actually the drive for us is always the outcome for the individual, and being sat in A&E for 12 hours, 24 hours is not something that we would ever wish to think that we're not doing everything we can to play our part in improving. So yeah. Thank you.
Thank you very much. Thank you, Chair.
Councillor Healy.
Thank you, Chair. As I've said before, I've said this again. Thank you very much. And I must say, I take my hat off to you. You've got a horrible thing to contend with, but you work very hard and you do your best. As I said before, we talk about our NHS. It's on its knees. Why is it on its knees? Because it's been run like a business. Our NHS was never a business. It belonged to the people of UK. It is not a business, and it's run like a business. This happened when they brought the director of Sainsbury's to run the NHS, and that's when it went pear-shaped. Well, that's me on my soapbox. I just want to say one thing. Social services, social workers. Do we have any social workers in Betsy Cadwallader? Yes. And how many do we have? Thank you.
Thank you, Councillor Healy. Can I ask, do you mean, do we base our social workers in hospitals? Yes. Yes. So within each of our acute hospital sites, we have a designated hospital social work team. So for example, the team that are based in the Mylor will be there every day, and they will also be supporting the community hospitals that are linked to the Mylor. We have the same in the Countess, and we have the same in Glenclwyd. So we have dedicated. How many? So we have, now then I'll have to do a quick count. We have, with the new investment, so our new investment is for 5 social workers and 3 what we call community assessment officers. So a community assessment officer can do all of the work that a social worker can for a lower level of need. So there are some people who need a social worker, and some people whose needs can be met by a community assessment officer. So we've got 8 total in the new investment. I believe, and the CAOs are all new. We didn't have CAOs in the team before. I believe we had 2 in each before, but with your group, I will just make sure, because we had some that would cover different hospitals, but we've more than doubled our total capacity with this new investment.
But yes. Those social workers are not only in the Mylor. They are on 3 sites, on Glenclwyd, Bangor, and the Mylor.
Yeah. Thank you. So just to confirm, it's the Glenclwyd, the Countess in Chester, and the miler. Yes, we have teams, we have the same. And although the teams are based within specific hospitals, they do work as one team as well. So actually, if there's sickness in one team, that they're all under one team manager. So they will deploy them to support people who've been waiting the longest. So we will work like that. We work on the basis of being primarily set in a hospital because it helps with relationships. Just finding your way around one hospital compared to another hospital, some of those real logistics. So, but yes, we have them in every hospital. Your experience as a patient from a social work perspective, irrespective of which hospital you're in, will be the same.
But each of those hospitals have slightly different processes. So for our social workers, because you're working in a Welsh system, an English system, and some different, so whilst we deploy them, part of our challenge is we have to work 2 nations, 3 hospitals, 3 systems.
Councillor Thew.
Thank you, Chair. And that just highlights the problems we have, doesn't it? You know, we need our own hospital. There's no doubt about it. We're tripling our workload, and computer systems don't speak to each other in England and in Wales. I mean, it's just a nightmare. The size of our county, we deserve our own hospital. I note in the news this week, the Royal Alexandra Hospital is sort of back on the agenda again. Why can't we look at a site for ourselves? I know it would take years to come to fruition, but it's just the workload is incredible, and we're just thinking something has to give, and it's about time that we looked into that possibility. I know from in 108 and 109, we're getting this extra money, this grant, 1.4 million annually, but that's not going to increase year on year. It's going to stick at 1.4 million. It's just beyond belief. I think, measures must be taken now to start looking at a site. I'm welcoming the fact that we've got the new care homes in Flintshire now, and somewhere to put our residents in their later years. And having been in the situation with an elderly relative a couple of years ago, coming out of hospital, it was 13. It didn't involve a break at all, a fall. It wasn't. She didn't receive a serious injury, but it was 13 weeks before she was placed in a care home locally. We were offered out of county originally, which again, Flintshire residents have to travel. We're such a big county, such a lot of people. We shouldn't be in this position, and I'd urge people to get behind the idea that we look for somewhere for a purpose-built hospital in our own county. Thank you.
Thank you. I believe members will remember that the Betsy Cadwallader Health Board attended just before Christmas, and the point in relation to the provision of hospital and the position that was put as part of that discussion around Flintshire's provision was made directly to Betsy Cadwallader Health Board. So just to acknowledge that is something that I know that the council has previously raised. I think also just to refer to the provision of additional in-house capacity. That's clearly been a well-supported position that Flintshire has taken, and we've benefited from being able to use the support that we've had from council to maximise opportunities to achieve funding from Welsh Government. So we've, as you will be very well aware, both from a Marleyfield House perspective and the recent new build at Tea Croes Atty, as well as providing additional long-term placement opportunities. Both of those are very much part of our hospital discharge, what we call discharge to recover and assess pathways. And we're very much looking forward to T. Croisati becoming fully operational in that regard. Yeah, sorry. And that's the next item on the agenda, I've just been reminded. Another segue potentially. So thank you.
Thank you, Karen. We'll move on to the recommendations. There's 2 in the report. Are you hoping to move those, Councillor Mackie, or?
If I may, Chair, I would like to add to the first recommendation to recognise the work, recognise the difficulty of the situation facing our officers. Yes, that's what I would like to put in. I would like it to say something like that members recognise the difficulty facing our officers and support the ongoing work to reduce hospital discharge delays. I feel it's important that we should say that as well. Sorry, and I propose that. It's me.
Councillor Jones.
Diolch. Thank you, Councillor Mackie. I appreciate those comments because our staff are under immense pressure from, to get people out of hospital, but they do ensure that before they come out, they are well enough to come out. And the pressure that they're put under sometimes is immense, and they will not accept anybody that is not fit and able to come to be discharged and come home from hospital. So I appreciate the thanks that you are giving because our staff are under immense pressure. And that includes the social workers who are in all our hospitals as well.
Councillor Thew.
I'd like to second Councillor Mackie's proposal.
Okay, so we've got, do you want that as a third recommendation, Councillor Mackie, or just amend the first? Do you think? Yeah, we'll put it as a third recommendation. So we've got the 2 recommendations in the paper, plus the recommendation which has just been outlined by Councillor Mackie. It's been moved and it's been seconded, so could I have a show of those in favour? That's everybody. Thank you very much. Just on that, or related to that as well, members will probably remember that at the meeting at which BCUHB came, they did invite members of the committee to visit Wrexham and to observe and report back to this committee. Now, I'm not sure they'd want the whole committee to turn up on one day, but I think it's the intention that a date is going to be set and then members will be asked if they'd like to go, and probably be on a first come first served basis, I suppose, because I suspect a lot of members will be interested in going on that visit. So that's we're looking into getting that organised, just so you're aware. Just keep an eye on your emails if you'd like to go. We've been going for nearly 2 hours. We've got one agenda item left, so I'm minded to say we have a quick 10-minute comfort break so people can go to the toilet or get a drink of water, and then we'll come back and do the final agenda item at, well, I've got clocks telling me different times here, so 10 past 4. Right, agenda item 6, which is T. Croisati Residential Care Home Capital Development. I'll hand over to Jane Davies for this.
Diolch fawr, Cadeirydd, diolch fawr. I'm hopeful that my colleague Karen will step in where necessary to assist should that be required as well. So thank you for the opportunity to talk about this fabulous building. So yes, as you know, T. Croisati is the new older people's residential care home based in Flint, built on the former site of the old community hospital in Flint. It was a concept that came because of the work that was supported by members and others regarding the development of additional capacity within the in-house provision for residential care. across social services and was fed from information that we have reviewed regularly regarding demand for residential care and residential EMI care and the other sectors of care across Flintshire. We've talked a lot today about demand, and you know, we know that that demand is ever increasing, and this is part of our strategy to help to mitigate some of that. I know many of you were at the visit of Tir Croesati a fair few months ago now, where it wasn't occupied, but the build had virtually been completed. There was builders on site, if we recall, and a bit of activity still going on. You'll be delighted to know that the residents of the Croesati care home have moved in. They moved in before Christmas in November and have all settled in really well, are absolutely loving the new building, their new home, and really enjoying being part of that new community within the building. And we've been supported so well by Mark Holt and Vanessa Roberts, who are the managers within that service, and the staff group behind those, who have made such a smooth transition. Everybody moved on one day, which is absolutely incredible, thanks to all the planning. So that's an amazing feat of engineering, to say the least, but also people management, and, you know, to get everybody happy and comfortable and moved into such an amazing space is just, you know, a credit. Councillor Christine Jones mentioned before about staffing, and I think that's testament to the quality of staff that we have across all of our services. So we're blessed to have those people. Just to pick through some of the points from the report, obviously the model for Tir Croesati is built on the success of Marleyfield House in Buckley. Many of you I know have been to Marleyfield over the years and seen the expansion of that service. Very much a proactive approach, looking at those significant pressures across the sector and some of the fragility and complexity issues. And it links very nicely with the work that Karen has been detailing previously about the hospital flow work, because we operate the discharge to recover and assess model within Marleyfield House, and look to develop that further for Tir Croesati as well going forward. So at the moment we have our residents settling into the premises, as I say, and also we will therefore be moving into filling up the additional bed capacity. So we've moved from 31 residents who were at Croesati to a 56 capacity building for Tir Croesati, obviously with some of those beds being made available, as I say, for discharge to recover and assess. The building, you know it, you've seen the pictures, I'm sure, in the appendices. It is a very modern building, designed to be carbon neutral. The materials that have been used in it have been designed and picked particularly for their carbon properties, but also to ensure that they are recyclable and that they have all the properties that you would expect to see from a modern and efficient care home. We've got an air source heat pump, which is amazing, helps us to utilise that in place of gas boilers, which heats the property. The property is absolutely insulated to the maximum, with even things like the orientation of the building being addressed so that we get maximum efficiency for the building. Going forward, at the moment, the building does need a small amount of carbon offset to keep it running because of the 24-hour nature of the building. However, as time progresses, we anticipate that that need will reduce, making it net zero carbon in due course. We were fortunate, as you know, to have received investment from Welsh Government to support this capital build. Welsh Government's Integration and Rebalancing Capital Fund invested 7.3 million into the property build, as well as the Housing and Care Fund, which invested 4.85 million, and the authority itself has also allocated funding into the cost of the build, meaning that we now have an asset within the authority worth 18 million, which is incredible for the authority itself, but not just for the residents who are obviously receiving so much benefit from the new facilities that are available. We, as a authority, as I've mentioned, are working very closely with the Health Board to ensure that we've got the care model in place that meets the needs of residents, but also the care model in place that meets the needs of our discharge to recover and assess services. And our preferred model of operation will be to have a GP supported model, which will also have a pharmacy option within it as well. We're currently in the final stages of discussions with the Health Board to ensure that we're all getting to the point where we have the model secured and we can move forward with that, with an anticipation that we'll be having that model up and running by April of this year. As I mentioned before, we've got some really passionate staff sitting within the T. Croesati facility who are there supporting individuals. We've also increased the staff capacity because clearly the building is bigger and has greater capacity and bed capacity. And we've been very fortunate to be able to secure additional staffing to date, and that ongoing recruitment continues. Seeing the progress that Flintshire is making in a really difficult market does help us with recruitment and retention of direct care staff. Seeing a progressive and forward-thinking organisation means that people want to engage with us as their employer, and that's a really important part of the messages that we want to send out about social services in Flintshire for the future, and not just from a care staff perspective, but across the board. Karen has already alluded to some of the challenges we have within recruitment and retention, and I think we've got a workforce report coming in the next few cycles of this committee that talks around that. But being proactive and demonstrating that proactivity is really important to our workforce and our future workforce. Also part of that as well is having those partnership arrangements, talked about health and the partnerships that we're so strong with Marleyfield and continues with T. Croesati, but also the partnership that we've had with Wilmot Dixon, who have been the construction company supporting this huge piece of work. They've been very committed to their social value commitments. They've undertaken time ensuring that they've allocated resources to the local community. They've made sure that their staff have been supporting local schools and colleges. They've been talking about career development. They've been doing additional curricular activities, and they've been supporting with things like safety talks and literacy. So they've really been engaged with the community in Flint and the surrounding area, and that demonstrates, what a strong partnership approach we've been able to have with Wilmot Dixon. And then, as you can see in section 1.09 of the report, there's information about the benefits of the in-house care home investment. Councillor Coppell raised it previously, actually, about a benefit analysis and understanding for the costs that you put in, what is it that you get back? And I think you can see from here that a significant amount of work has been done already to identify what those benefits will be over the next 20 years, and time will be taken to review that and to refresh those initial calculations so that we do understand what investment we have and whether that has delivered the services and the benefits that we've hoped that it would. And so we've used the model there of the net present value model for T. Croesati, which helps us to determine how profitable that investment will be over the next 20 years. And I think, if it's okay, Chair, happy to put Karen forward to take any answers to questions. No, I'm joking.
Councillor Buckley.
Thanks, Chair. I have no questions. It's just a lot of praise for everybody involved in making this happen. Luckily, being involved or been included in all the plans from the very offset, from the very beginning, and was lucky enough to go as my time with a different hat on as Mayor of Flint to the topping off ceremony as well. The transition has been faultless. I've heard lots of feedback from staff, who many of them are local to the town of Flint. And as mentioned, Flint was very sentimental about the current site, as it was the former cottage hospital site, and it dear to everybody in Flint's hearts, because at some point some of our elderly relatives spent their final days there. So the utilisation of the site now with this brand new spanking, all singing, all dancing care facility, extra care facility, is very much welcomed. Not just as an asset for Flintshire as a whole, but to the town of Flint as well. And I'm very, very proud to have that in our town. And I said I didn't have any questions, but I do have one. When can I move in?
Thank you for that, Councillor Buckley. Councillor Mackey.
Thank you very much, Chair. Thank you. Councillor Buckley, I was going to also raise the fact that this has been built on the old cottage hospital site. And when that closed, there was a great deal of concern within Flint that you must know far more about than I do. Although a lot of the complaints were going to the Community Health Council, which was then. I assume from what you said, and that one should never assume, I know, that the complaints and the concerns that were raised at the time when it closed have mostly been gone quiet, because what we've got in place of it is a significant development and obviously welcomed by the residents of Flint. What I did want to say was, a couple of times in the report it says that it's an £18 million investment. I added up the numbers and it's 19 million. You've got 27 million. Sorry, it's on paragraph 203. Sorry, 103, is it? It says that there's 14.35. I can't remember the other 14, but there's 2 14s and a 4, and there's, so I got that as 19. That's all I wanted to say, Chair.
Thank you. Get that changed.
Councillor Madison.
Thank you, Chair. Councillor Buckley, when you move in, I'll come with you. We can play cards together all day. I don't have a question as such either. I just wanted to say that this is a brilliant and positive report. I was on the visit. I really, really enjoyed it. And I hope it will be, in a way, a model to show that in-house care can be better managed. And we were talking about budgets earlier. Care was in the responsibility of local government when I started 50 years ago, and I don't think it was, badly managed at all. I just wanted to comment on section 108. As a former trade union representative, I do commend the use of the local supply chain by the builders. That's absolutely brilliant, because it's creating, it's very, very good for local industry. And again, that actually, I think, is also a model for any future construction. I also want to commend the work done by Wilmot Dixon with schools, talking about employment opportunities and career opportunities. I mean, that's brilliant as well, actually, from a future employment point of view. And also, I also want to commend the employment opportunities that this enterprise will offer in the town of Flint and the county of Flintshire. So, no questions as such, just praise. Thanks very much.
I'm very grateful for committee's reflections and support. We have talked a lot today about demand, a lot about hospital pressures, and the workforce enjoy the moment of opening T Croisati, but for me, it's what's next, because we do need to consider where we go next with our expanding in-house services so that older people can be supported in high quality care locally. And that's come across as a message from yourselves very loudly today. The commissioning team, planning and commissioning team, have commenced a piece of work really looking at projections of need, demand, what we need in terms of residential EMI and nursing care going forward. So my ask is that we will be coming back, we will be getting into then thinking about what's the next phase. As people reflect, we've got a model that works. We need to think about what we need next and how we continue. So it's a journey. We've really important milestone. Really good that we stop and recognise and celebrate. But my ask is that I will be coming back to ask for support for around further developments. Thank you.
Councillor Healy.
Thank you very much. This is a fantastic project, fantastic. And it's somewhere where care of the elderly is in-house, and it's a fantastic building. But I do have a question. My question is on the builder, Wilmot Dixon. Wilmot Dixon did build Casterhallen as well. He's not a local builder. They are based in Manchester. And my question is, why don't we give our tenders and have our local builders from Wales? The only one building that I know that was built by local building is in Minedisa School. Minedisa School, when I went to it, I did bring this up there. And I stood there and I was so happy. And the builders were very happy because they were local Welsh builders. So that's only, I'm just bringing this point, Chair, that can we use our own builders? We have got very good builders in Wales. Thank you very much, Chair.
Thank you, Councillor Healy. Yeah, really good point raised. Obviously, there is a procurement process that we go through when we're working with any spend of public monies, isn't it? That is particularly for projects that are such high profile. And you're right, we've had a number of projects over a period of time with Wilmot Dixon, who are based in England. Pleased to say as well that we've also had Coedydd Wraig, which I know you're very familiar with. That is MPH, the construction company, who Mull Plumbing and Heating, which is what MPH stands for, very local company. And as part of the social value framework that was introduced a fair few years ago now, and you'll remember, I'm sure, the commitment by any builder who is, and any other provider of services, is to ensure that there is value added to the local community, which is what you've seen expressed in the report today. So yeah, thank you.
I'd also highlight Reed Construction, which are local, the Teeneath and our children's homes as well. So there are some other examples.
Councillor Jones.
Deal. Thank you, Chair. Yeah, just really quickly, it really is a fantastic residential home. It's just absolutely amazing. Myself and Craig were there just before Christmas, and everybody had moved across, and it was such a smooth transition from their former home. And it was their homes, you know, they'd lived there a long time in Croisati. And, you know, if you're moving house yourself, you know how traumatic it is. And that transition over to the new Croisati wasn't a bit traumatic. It was so smooth, so easy, because our staff made it that way. And the removal men as well, I can't remember the names, Karen probably knows. They were fantastic. They were just so you don't know. They were just so good. Mark was saying they were just so amazing. They made everything so easy because these are people's personal belongings, and they were treated with such care. And the residents have just settled in so easily because it's just so beautiful, so friendly, so homely, but very all singing, all dancing, modern as well. It's gorgeous. They've even got a bar. And there's a picture of it actually on those pictures before it was set up properly. But the residents are so happy there. We were chatting to them, and it was as though they've always lived there. It was brilliant because it's really hard to move to a new home, isn't it? Whether it's moving house yourself or, but no, they've settled in so well. And again, great thanks to our staff for enabling that, and for the managers of the former Croisati. They've just been absolutely brilliant. So yeah, if you can have a little trip there, make an appointment, pop in and see it, you will be really, really pleased. But the thing is, they're being well cared for, the people who live there. That's the main thing, and they're happy.
Thank you, Councillor Jones. Recommendation in the report is that Scrutiny review and note progress regarding the T. Croisati development. Move. Seconder, Councillor Healy. All those in favour? That's unanimous. Thank you, everybody. And that concludes the meeting. So thank you very much, Diolch. And I'll see you in February for the next meeting. Thank you all.
Thank you, Chair. Bye, Elle.